How you doing? Dr. Williams, orthopedic sports surgeon. Just here after surgery, trying to spend some time answering some of your questions. I'm an orthopedic sports surgeon in Houston. I take care of athletes in multiple sports, and I'm just going to get started in a little bit. Just waiting for people to come in before we get started. So thank you for joining. I see the cat join, Peace join, Gordon is here. Thank you guys for joining. I'm just going to give this a few more minutes before we start taking questions and we can get going. And I see Poppy Frank B here. Thanks for joining. Chris joined, Eunice joined. So when we get started, just feel free to ask questions in the chat and comment on it, and we will get started about any of your questions that you have regarding sports medicine and orthopedic surgery, but specifically sports medicine. I take care of injuries of the shoulder, hip, and knee. So if you have any comments or questions about issues regarding that, we can get started. I can just give you an idea of what I did today. I had 2 surgeries today. I took care of a cartilage injury in a knee and a ACL tear in an individual. So I did 2 of the surgeries and I'm done for the day. And I'm just here taking care of your questions. So appreciate you guys joining in, and then we can get started. I have some questions here already. Brazil 78 asks, I'm having bad runner's knee. What is the cause? I'm a runner and it's been happening lately. Runner's knee is typically a cause of pain because it is an imbalance of the muscle forces around your patella. And the term for this is called patellofemoral syndrome. So what happens is that the kneecap doesn't sit properly in the center of the femur. And when you run, the muscles around your knee are pulling the patella in different directions. That causes pain in the front of the knee. Best way to treat that is with physical therapy to strengthen the muscles surrounding the knee, to strengthen that patella to make sure it tracks centered into the femur. And that usually prevents the pain that is common in runner's knee. But thank you for the question. I'm going to skip around to these questions here. Josh Lamb asks, how serious is the Kristaps injury? So Kristaps Porzingis, for those who don't know, is a Celtics player, a great NBA player. And he recently had another injury to his leg. It's unclear what the actual injury is. It sounds like it was a lower leg injury. It's a very odd and uncommon injury. It is a posterior tibialis tendon injury, which is a tendon that affects the foot and the lower leg. If that is indeed the actual injury, that is a sprain, or it's something that may be able to be taped up and braced for the remainder of the playoffs, and you might need surgery if it is severe enough to warrant it. But it is a very uncommon injury, and I don't have very good insight on the exact intensity of his injury. D. Pugdrippin asks, when can I run after ACL surgery? So ACL surgery is very common these days. And for my patients, I usually have them start running around 4 months or 3 to 4 months. So that usually is contingent on the amount of strength that they have in their knee. And that usually takes about 3 to 4 months after the surgery to have that strength after an ACL surgery. Gonzalez and Delaz asks, best way to manage nerve impingement in the hip? I've tried PT, looking to steroid injections. Unclear what you mean by nerve impingement in the hip. There's no real entity of nerve impingement in the hip. There is impingement of the hip, which is usually from a labrum tear or actually a bony issue. So a nerve pain or nerve issue in the hip is usually from your spine. So if it is a hip impingement, that's usually from a bone or a labrum, that usually helps with PT and steroids. Special TikToker asks, hi, I got 2 ACLs on the knees, all because of soccer. Do you have any tips to protect myself? It is very common for soccer players to get ACL injuries. Unfortunately, it's even more common in female soccer players to have ACL injuries. and that is because of some anatomic changes in the leg in a lot of female athletes. And it is common to have bilateral ACLs in this population. So the best thing you can do to prevent ACL injuries in the future is to work on your landing mechanics and how you load your knee and leg when you do pivoting and cutting sports. And that usually is a strengthening issue that can be performed with physical therapy. Nico S says, D1 football player, how can I prevent AC joint sprain? So AC joint sprain is basically a separation of the shoulder. It is hard to prevent it, especially in contact sport like football, because you land directly in your shoulder often. So the best way to protect it really is to prevent landing directly in your shoulder, which is impossible for some football players. Sometimes you can pad the area, but there really is no brace or anything that will prevent that. Big Tom says, I have a slap tear, but my doc wants me to go through physical therapy for a year. So it's common to go through physical therapy for most of these injuries. So slap tear is an injury to the labrum around the shoulder that helps to stabilize the shoulder and causes pain if you have an issue with that. I always, for the most part, prescribe some physical therapy for the injury initially. And sometimes it gets better. I usually give it about 6 to 8 weeks before I decide to do surgery for something like that. Coach says, Phil, hey, what's up? Giovanni says, what broken toe from jiu-jitsu, what should I do to treat it? So depends on what toe that's broken and where the toe is broken. In general, toes can be treated with taping if it's a minor toe injury. It usually takes about 6 to 8 weeks for the recovery. Katie asks, what do you know about hip dysplasia? Hip dysplasia is a condition that affects the stability of the hip. Usually it's because of the socket of the hip is not deep enough. It can be treated a variety of ways. Many times, if it's bad enough, it might require basically reshaping the hip socket with surgery. Don, don't add me, 1989 says, bucket handle tear my left knee 2 years ago. Pain went away and have motion, but feels tender. So bucket handle tear is a severe tear of the meniscus and usually requires surgery because it blocks up the knee, and it is a severe tear of the meniscus. And meniscus repair is a very good option to fix it, to get you back to activity. If it feels tender, I would recommend seeing an orthopedic surgeon to get it looked at, because there might be further damage in the knee after that. Carson Noiston says, what do you know about discoid meniscus? And guys, sorry if I don't pronounce your name properly. I'm doing this quickly. What do you know about discoid meniscus? So discoid meniscus is an abnormal shape of the meniscus. It's usually the lateral meniscus, and it's a congenital issue that some kids have, and they don't realize it until they have locking and catching in the knee. The way I treat a discoid meniscus is that if it is symptomatic, they have a surgery that basically shapes the meniscus into a semicircle, and it gets repaired at the same time, and patients do very well. I've had a lot of patients who've had the surgery, and they all have been doing very well. Someone asked, is PT required after ACL surgery? Yes, definitely ACL surgery requires physical therapy. It's a very important component of the recovery process. Jack Boy 1 says, what should I do if I'm a teenager who's having back pain doing wrestling and baseball? Wrestling is a very stressful sport for your back, your lower extremity. And if you have severe pain in the back with those activities, it is useful to get an x-ray to make sure that there's no back fracture or a minor fracture in the back, which might happen with a lot of these sports that cause a lot of extension of the back. So I'm going to have to skip around with these questions. So I appreciate them. I can't get all the questions. So if I miss your questions, send me a DM or comment on my page. I can help to hopefully answer them at some point. So I'm going to skip around. Tisa says, can you explain a non-contact ACL tear and how do you prevent it? So ACL tears are very common. They usually happen without contact. So non-contact injury is typically an ACL tear. So if you see someone playing a sport like running on the field and they pivot and their knee kind of buckles, that is typically an ACL tear. ACL tears don't usually happen from contact. It's because of how the knee rotates and shifts. And that is why ACL tears happen randomly. People jump up and down, land awkwardly. It is a non-contact pivoting injury. And so there really is not a great way to prevent it other than focusing on how you land in a sport and how you pivot and change direction. That usually requires a lot of feedback in terms of how your body is lining up when you run and jump. And so that is really the only way you can really prevent these non-contact injuries. Um, okay, I'm going to skip around once again. Thanks for your injury. Thanks for your question. Krutsky Kursky Band says best way to prevent Tommy John elbow surgery. So Tommy John elbow surgery is a ligament reconstruction surgery on the elbow. Usually, a lot of pitchers and overhead athletes have this injury because of the high stress that is required for pitching, and it is a long recovery, usually about a year. The best way to prevent it is to not to have an injury to your elbow to begin with, which is actually possible by limiting the amount of throwing that you do. A lot of little league athletes have pitch counts that are very important because the more stress that you put on your elbow, the higher likelihood you will have to you might have these elbow injuries. So pitch count, lowering your pitch count, making sure you stay within a certain number of pitches helps to prevent these injuries to the elbow. So that really is the main issue. But aside from that, one way to prevent elbow issues is to actually work on other parts of your body. So a lot of people who have elbow issues that require surgery, like Tommy John, they have tight shoulders and they have poor core balance. So working on your core, working on your shoulder, and working on your mechanics helps to prevent Tommy John and other elbow injuries. So I'm going to move around here. So sorry if I skip your question. Um, Send me a DM if I miss it. And um, so Avery Close says, I had a posterior lateral corner injury from a knee dislocation, damaged my peroneal nerve too. So that's a severe injury. I'm sorry to hear about your injury. A posterior lateral corner injury is a injury that happens to the knee when you have severe trauma, like a knee dislocation. And because of where all the trauma is, many times the peroneal nerve, which is the nerve that controls the lower foot, can get injured too because it's in the vicinity of the injury. So you have these injuries that happen together, the peroneal nerve injury and the posterolateral corner injury, because of the proximity of all those structures. And the injury requires a reconstruction of the whole outside part of the knee, the lateral part of the knee. And sometimes if you free up the nerve and free it up from the damaged area, some of the nerve function might return, but it can be a long recovery. So I'm going to skip around to some questions. Luke says, how do I describe an MPFL tear to a person who asked? So MPFL tear is from patella dislocation or patella instability. MPFL stands for medial patellofemoral ligament, and it helps to keep the patella centered in the femur. And when you tear it, you have an unstable patella. And for people who have multiple dislocations of the patella, sometimes they might need an MPFL reconstruction to stabilize their patella once again. I don't know what to call this, as I've had 3 meniscus surgeries. Any tips to help strengthen and pain? It's been 3 years since. So having meniscus surgery multiple times can long-term make you susceptible to arthritis or other nerve or other joint problems. So really it's strengthening the knee in general, keeping good, healthy weight to prevent any joint problems in the future is probably the best thing you could do for that. Odie says, I dislocated my kneecap with trochlear dysplasia 4 weeks ago. It's still swollen. Should I worry? So once again, kneecap dislocation or patella dislocation, same thing. On top of that, you have trochlear dysplasia. So the trochlea is the structure that the kneecap sits on and on your femur, and it should have a good relationship in terms of the trochlea is like a valley, and it helps to stabilize the patella. If you have trochlear dysplasia, that means that the valley is more flat, and so the patella is able to dislocate easier. So if you have known trochlear dysplasia and a dislocated kneecap, the patients that I see with that condition usually require surgery because the anatomy is not conducive to a stable joint. And so it usually requires a surgery to stabilize that joint to prevent future dislocations. I'm skipping around to other questions. So I see a theme here with patella stuff. So Colin says, I'm 6 months post TTO and MPFL reconstruction. What should I focus on now for my recovery? So TTO stands for tibiotibial osteotomy, and MPFL reconstruction is a medial patellofemoral ligament reconstruction. So this combination of procedure is for people who have patellar instability, what I was just kind of talking about. So that is kind of a typical procedure for someone who has recurrent patella dislocations. And at 6 months post-op, for people who I have this operation performed on, usually they are doing more active things and getting ready to run, if not running already, and getting ready to play their sport. So by 6 to 9 months, I would really think that patients would be ready to start doing their sports by 6 to 9 months after this type of surgery. Just to make clear, I'm not a spine surgeon or a back surgeon, so I will not be answering questions about nerves or back pain. Thank you for your questions. If I don't answer, just send me a DM. So I'm gonna skip around here. Sydney asked, "What does a torn meniscus feel like?" That's a great question. So a torn meniscus, for some people, if they have a new meniscus tear, it usually feels like a catch or locking in the knee, like their knee gets caught or stuck, and it's painful, obviously, and it causes swelling as well in the knee. But it feels like there's something stuck in the knee, and they can't really bend or move. Move his, and they can't move your knee freely because it feels like something is stuck, like a pebble or something in it. Again, a lot of people are talking about Porzingis' injury. Again, I don't know his specifics, but what they have described is a very unusual injury to his lower leg, his posterior tibialis tendon, or his posterior tibialis muscle, which is on the medial part of the knee, the medial part of the leg, and really controls kind of pushing off with your toe and controls the arch in his foot. So if that's truly the injury, it's very unusual and depends on the severity, but he might be able to be braced up and be able to play limited. But, it sounds like he's going to try to do whatever he can to play. Just moving around here. Thanks for your question. BatGoat417 says, I have a high ankle sprain right now. What should I do? So true high ankle sprains can cause instability of the ankle, and that might require surgery depending on how unstable it is. If it is not unstable, it usually requires several weeks of immobility and limited weight bearing to allow things to heal, because the ankle can be unstable for something like that. Kimchi says, hey doc, what does a torn rotator cuff feel like versus just a tight shoulder? So that's an excellent question. A rotator cuff tear is the tear of the tendons that surround the shoulder that help you to elevate and move the shoulder. And someone who has a torn rotator cuff that is relatively new has pain, number one, but they also have pain and difficulty lifting their arm, and they have weakness. So if you want to differentiate between a tight shoulder and a rotator cuff tear, it is a rotator cuff tear has weakness and pain. A tight shoulder just has some pain, but they wouldn't have any weakness. So weakness is kind of the telltale sign that there's also a possible rotator cuff as well. Skip around. So I'm gonna skip around through these questions. Sorry if I miss it. Just send me a DM. Willie T27 says ACL surgery recovery timeline on 25. So ACL surgery typically It depends on how severe your other injuries are, because sometimes with ACL injuries, you have a meniscus tear, you have MCL injuries. But if you just have an ACL tear and you have surgery, typically the first 4 to 6 weeks, you're trying to get your full range of motion back. After the first 6 weeks, you start to do more strengthening things to get your knee stronger. Usually by 4 months at the most, you want to be able to start jogging and running. By 6 months, patients are usually doing pivoting, cutting, and sport specific exercises and sprinting. And by 9 to 12 months, you might be able to start thinking about returning to sports if you play a competitive sport. So it's typically a 9 month recovery process to going back to playing a sport at a high level. Um, Jay asks, what does plica syndrome feel like in the knee? And can it be similar to meniscus tear? That's a great question. So plica is basically a band of tissue in the knee that is there from birth, but sometimes can get irritated and painful in some people. And it is very hard to diagnose before surgery. It really is a diagnosis of exclusion, because patients might have a normal MRI and have no findings and still have pain. And that's someone who usually might have a plica that is not seen on an MRI. And that can be taken care of arthroscopically during surgery. Um, Dinah Cole says, "Hey doc, what's the most painful injury?" That is hard to answer because everyone has obviously pain perception differently, but anything in the femur, breaking the femur is probably the most painful thing you can do because it's the biggest bone in the body. I'm going to skip around to some questions here. Um, so Jared says, 2 years after 2 years after Achilles rupture repair and still have pain, what can cause this? It's hard to answer that question because it depends on the type of repair that you had. Sometimes if you have anchors placed in your heel from the repair, the anchors themselves in the heel can cause tenderness and irritation. Sometimes you can just have a lot of pain around the muscle and just muscle soreness. So if it truly is painful and it is limiting your daily activities, I would recommend seeing a foot and ankle orthopedic surgeon to figure out if there's a actual source that can be treated for that. So Koch AB12 says, how difficult is it to get a job with an NFL team or professional sports as a sports med doc or ortho? That's an excellent question. So the NFL has obviously contracts with a lot of hospitals. So a lot of times, a lot of these sports medicine physicians who are excellent physicians are part of a contracted hospital system where the NFL teams work with them, and the orthopedic surgeons associated with that hospital system become the sports medicine physician for the team. So it usually works through the actual hospital system. And if you are associated with that hospital system and you're a orthopedic surgeon or a sports surgeon and you have that affiliation, you could have the opportunity to work with an NFL team. And of course, you have to be an excellent physician as well. So it's really a matter of excellent training, excellent physician, and being part of that network of hospitals to get a professional sports association. Jack asks, what can I be doing in high school if I want to go into sports medicine? Really is doing well in school in general. I mean, that's a um, question that I get often, and really is doing well in in school and going well, going to college and going to medical school, but it's really kind of doing well, showing interest in sports, finding an orthopedic surgeon to possibly shadow, and starting research early and often in college and medical school is the way to do it. Just skipping around here to other questions. Um, So Brian asks, any good exercises for a meniscus tear? The only exercises I really recommend for a meniscus tear, because you really can't heal a meniscus tear reliably, would be to work on knee strength in general. So working on your quad, your hamstrings, and getting good mobility back in your leg. Um, so someone just asked, oh, so Senator MJ says, I'm a medical student at a solid school in my second year. How do I guarantee a good match? I mean, you can't guarantee a good match, obviously, but doing research is the best way to ensure that you have a great chance at matching at a very good residency program. Research and just doing well in school and having good recommendation letters. Um, so Garrett Chase has said, I just had knee surgery Thursday and I have a lot of fluid built up. When will it go away? Obviously, I can't answer your specific question because I don't know what surgery you had and I'm not your surgeon. But for knee surgery, typically within a week, the fluid should get better in terms of the swelling for knee arthroscopy procedures, because we use fluid during the procedure to actually do the surgery. So there's actually fluid that goes in your knee, and that actually causes a lot of swelling because of the actual surgery requires fluid to be in the knee. Usually it goes away over the following week. And I don't really get concerned about fluid in the knee after surgery unless it is more than 4 to 6 weeks after surgery. So Glee says, I dislocated my shoulder about a year ago while cliff diving. Ever since it keeps dislocating. So if you dislocate your shoulder, first of all, if you dislocate your shoulder before the age of 18, you have almost a 95% chance of dislocating your shoulder again in your life. So the younger you are, if you dislocate your shoulder, you have almost a guarantee that it's going to dislocate again, unfortunately. If you dislocate your shoulder and you're older and it keeps on coming out of the socket for various reasons, that is a clear indication to me when I see a patient like that they need a stabilization procedure for their shoulder. And usually it's a labrum repair surgery that is pretty well tolerated and patients do very well from it. So if you have repeated dislocations of your shoulder that interfere with your daily life, that is an indication for a shoulder stabilization procedure of some sort. I have about 10 minutes here. Josh says, partial torn labrum with hip impingement. What should I do? So that's a very common combination of injuries in the hip, and it's also known as hip impingement. And typically for a patient like that, I start with physical therapy to see how that patient would respond to physical therapy. If I have any question about whether or not the pain is coming from the hip or somewhere else, I would do an injection of anesthetic in the hip joint to see where it's coming from. And if physical therapy doesn't completely alleviate the pain and they still have problems, a hip scope, which is a hip arthroscopy that fixes the labrum and takes care of any bony prominences, is a very successful surgery for that injury. Power says, if my body rejects a cadaver ACL, does my body basically eat it? So the question is basically about ACL reconstruction with a cadaver graft. So cadaver graft is a non-living tissue that goes into your knee. So because it's non-living, it doesn't have a capacity to be rejected by your body. It's not like an organ transplant where your body can reject it. So cadaver grafts don't cause any kind of rejection or anything like that. The issue with a cadaver graft is that it may not be as strong as your own graft because it has some weakness that is inherent to it because of how it is cleaned. Actually, the sterilization process causes it to become weaker. So there is no inherent rejection properties that occur with cadaver grafts. It's just that it might be a little bit weaker for the purposes of sterilization. But the reason why cadaver grafts, I think, works for some people is that for people who are older and don't do a lot of activities, cadaver ACL grafts work very well because it's a quicker recovery for an ACL reconstruction, and patients can have great outcomes with cadaver graft in the right situation. I don't do it for everybody by any stretch of the imagination. FDS with some string of consonants says, is PRP recommended for small labrum tears? Depends on where the tears, if you're talking about the shoulder or hip, because there's a hip labrum and then shoulder labrum. There is no good studies that show that PRP actually changes anything in terms of the property of the tear. It may help with pain. So you're talking about pain for PRP. So PRP does have a role, I think, for improving pain in a lot of conditions. It has a lot more evidence in arthritis of the knee. It actually helps with pain in arthritis of the knee. So there is no inherent downside for a PRP shot. The only downside is the cost of PRP because it's not covered by insurance, and depends on where you go. It can cost anywhere from a couple hundred to a couple thousand, depending on where you go. And that's the only downside of PRP, in my opinion. Brandon says scapular winging help or issues with uneven shoulders. So scapular winging is a condition where your shoulder blades don't move symmetrically, and it can be for a variety of reasons. It can be because of nerve damage. It can be because of muscular imbalance. It can be some genetic issues, congenital issues. But the bottom line is the scapular winging or scapular abnormal motion of the scapula can be treated with physical therapy initially. And if it is not improved with physical therapy, a shoulder expert can evaluate that and fix that. We actually have a shoulder expert on scapular winging at my institution at Baylor here in Houston who does a lot of surgery for scapular winging as well. His name is Dr. Ahmed. So Hudson Thrasher says, will Kristaps Porzingis play tonight with his injury? So I'm going to go back and say he's going to play tonight for the reasons that I've mentioned several times, is that he has a very unusual injury. His posterior tibialis is injured. I haven't really seen that injury common in basketball players, especially, but I think he will be taped up or braced up enough to have some ability to get out there. I don't think he'll be able to jump as much, but I think he will get out there and play. And he might need some kind of surgical repair after the season. So Robert says, how do I notice if I retore my ACL besides just pain? So usually you would have swelling, but instability is the main symptom that you would feel. You'd feel like your knee is loose and you feel like you don't have much confidence in the knee. So Pieces of Me says 4 ACL reconstructions on the left and 1 on the right, both torn again. Is it worth another surgery? So first of all, I'd say with that number of ACL reconstructions, I would make sure that you would have a very comprehensive workup as to why you keep on tearing your ACL. And many times there has been evidence recently that the slope of the bone, basically your tibia, might have an abnormal shape to it that might require bony procedures to actually fix the slope of it's called the slope of the tibia. So the slope of the tibia might be abnormal, and that might be causing more stress on the ACL to make it more susceptible to tearing. So if someone that I see has multiple ACL surgeries that have been failing, you have to take a step back and figure out what else could be the problem besides the ACL. And many times it can be the anatomy of the knee or other structures within the knee that are not addressed, like the meniscus or the MCL or LCL or something else happening because the ACL is seeing more stress than it should be. So a few more minutes and then I have to leave. Henry Kasich is asking about pubalgia. So pubalgia is basically pain around the pubic bone that usually is from what we call core muscle injury or a sports hernia is what it is commonly called. And it's basically the abdominal muscles can pull away at the bone at your pubis and cause pain and basically tear at that point where it touches the bone. And it happens a lot to soccer players because of how they are bending and kicking. And it happens to football players as well. It can be treated with physical therapy or a procedure that basically fixes the hernia of the torn muscle, and patients do very well afterwards. Um, so just skipping around, um, Abdallah 333 says, "Are bio screws used for ACL surgery? My surgeon won't use a graft." I'm not sure what you were referring to, but we use biocomposite screws for ACL surgery. Usually, if you have an ACL reconstruction, you use some sort of graft, meaning you take a tendon from somewhere in your body or a tendon from somewhere else, and that's called a graft, and you reconstruct the ACL with that. Otherwise, something that I do as well is you repair the ACL, which is where you stitch your own ACL together and you fixate it with a screw and some buttons basically to suspend it and fix it that way. So it's either a graft or repair, but a screw alone does not fix the ACL. So I'm going to take two more questions and I have to go. Rajon Rondo. Yes, I used to be called Rajon Rondo when I went to I used to live in Boston. People used to think I looked like Rajon Rondo. Um, so let me look for one more question. Again, send me a DM if I missed your question. So when can I play? So Plenty Bree says, when can I play tennis again after an Achilles tendon rupture repair? Typically, I'd say 6 to 9 months, depends on your recovery process and your physical therapy, but make sure you get your strength back. Marcus, read mine, please. Just got surgery yesterday. I don't know what your question is. Sorry, missed it. So one more question and then I have to go. Thank you for the question. Again, send me a DM if I miss it. I'm going to skip around here. Whose question should I answer? Whose question? Dylan Kalinowski says, blew my knee out in football, ACL, MCL, meniscus, and fractured tibia. They threw pins in. That's quite an injury. So I would be skeptical that they just threw pins, and I would think that they reconstructed a bunch more than just putting pins in the knee. Derek Herbenson, can Porzingis play? Yes, I would say if I were the surgeon, orthopedic sports surgeon, taking care of the injury that they have so far let the media know or let the public know, which is very obscure. I'm not even sure what the actual injury is because they're not very clear about his injury. But what, based on what they said, I would let him play. So let me see if I can get one more question before I have to go. Who wants the surgery? Sorry, I'm trying to get one more question in. Oh, sorry. Sorry, guys. I'm trying to get one question in, and it keeps on coming up. If my ankle got dislocated, does that mean I tore a ligament? By definition, if you tore your ankle, you have to tear a ligament. That's just by definition, unless you have very loose, if you're ligamentously lax, but that's pretty much by definition, you tore something. So Jason asks, this is my last question. Jason asks, I dislocated my shoulder and tore my labrum post-op 1 year ago, and still hurts. Any suggestions? So that can be from scar tissue, that can be from residual tearing. If it still really bothers you, I would advise you to see your orthopedic surgeon who did the surgery. So again, so sorry I have to go, but appreciate all the questions and comments. Again, if you have any questions or anything I didn't get to, just send me a DM and I will try to answer it. And Thank you for tuning in. Hope to do this again sometime, maybe next week. Thanks, guys.